I am Dr. Srirang Gapkari, consultant physician at Uday Omni Hospital. Today we'll be sharing something about diabetes mellitus. All of you have heard what diabetes is all about. Whenever somebody has a very high blood glucose level, we evaluate him and then find out whether he has diabetes mellitus. Broadly speaking, there are two types of diabetes, type 1 and type 2. In type 1, there is total destruction of the specialized cells which produce insulin in the pancreas, and therefore, these are generally young children who require insulin. We cannot manage them with oral tablets. So, lifelong they will require insulin. There is absolute insulin deficiency in their body, and therefore, they need to take insulin. They are to be taught how to take insulin, how much to take, and what happens if the sugar goes low. And with proper counseling and treatment and regular insulin, their sugars can be controlled and then they can lead a normal life. But they require regular monitoring not only of the blood glucose but other parameters like kidney, their cholesterol levels, the protein leakage in the urine, eye checkup for retina involvement, etc. The other type of diabetes which we commonly see is type 2 diabetes, generally seen in young or middle aged people. Here, although there is some insulin deficiency, initially you can manage them with tablets. There are a wide variety of tablets which are available to manage the type 2 diabetes. Some tablets stimulate your body's insulin so that its production increases, while others help the insulin which is already present in the body to work better. Newer tablets are coming which help to excrete the excess sugar in the body from urine. So, a lot of times with these tablets we can achieve a very good control. However, if with the tablets the control is not there, then you may require insulin in type 2 diabetes as well. There are certain conditions in diabetes where insulin is essential. Example, if somebody has got an infection, during the perioperative period, that is just before the operation, during the surgery and after the surgery, we generally prefer to give them insulin. And somebody who's got complications of diabetes, like acute complications including diabetic ketoacidosis or hyperosmolar coma, where the sugars are very, very high. They may be anywhere beyond 500, and in such cases, you have to necessarily give them insulin. Another case where we would prefer insulin is the gestational diabetes seen for the first time in pregnancy. Apart from that, whenever there is drug failure, that is, drugs are no longer effective or able to control blood glucose adequately, insulin is given. We have different types of insulin, and it is very easy to administer insulin, but you require regular monitoring at home with a glucometer. Whenever we are talking about diabetes, we should not only focus on the blood glucose levels, that is, any blood glucose level more than 126 fasting or a postprandial blood glucose level more than 200 constitutes diabetes. To monitor the control of diabetes, in addition to these two parameters, we also have something called as a glycosylated hemoglobin, which gives us the average for the last 3 months. In such cases, we generally aim to have the HbA1c or glycosylated hemoglobin somewhere between 6.5 to 7%. However, somebody who's elderly, somebody who's got a cardiac disease, a slightly more relaxed control up to 7.5 is also acceptable, as the high blood glucose levels are dangerous, causing a lot of complication. Similarly, low blood glucose or hypoglycemia is also dangerous and a medical emergency. So if the blood glucose goes low, every diabetic patient should know what can happen. There can be sweating, there can be hunger, there can be shaking of hands or tremors, you may feel dizzy, and then if corrective action is not taken, you may actually faint and fall down. So we instruct every diabetic patient to be aware of these symptoms, and if they are experiencing such symptoms, they should take something sweet immediately. So they can have some chocolate, they can have some sugar or sweet, whatever is available nearby, so that the blood glucose level rises. Despite taking this, if the blood glucose level is still low, immediately rush to the hospital where intravenous glucose can be given. All diabetic patients should also take care of their foot. So before going to bed, you should examine your feet and see whether there are any small ulcers. What happens is, because of the complications of diabetes, sometimes the blood supply to the feet may come down and the sensations of the feet also may come down. So when there is some pricking, then a thorn or a stone actually injury is there, or if you have some ulcer, you may not have any pain. And if you don't have pain, you don't see it. And once you don't see it, you may see it only when it becomes very large. By the time the diabetic ulcer becomes very complicated and may require many treatment, injectable antibiotics, it may require surgery. So it is a good habit to take care of your feet, keep them dry, observe them daily before you go to bed, and then you can also wear some specialized chappals called as microcellular rubber chappals or shoes which are available so that your feet are taken care of. In addition, we counsel every diabetic patient to take care of their eyes. Normally, we see that everybody checks for a refractive error. Cataract obviously develops over a period of time in elderly people, but you also need to take care of your retina. Retinal damage, if occurs, it can be permanent. So every diabetic patient, at least yearly once, should have a retina checkup to see whether there is any diabetic retinopathy and take the appropriate advice from your ophthalmologist. One other dreaded complication of long-standing uncontrolled diabetes is diabetic nephropathy, wherein there is leakage of protein from your kidneys, and that leads to kidney damage over a period of time. Serum creatinine can increase after some time, and therefore, in a diabetic checkup package, we generally have a protein leakage test, which is called as a urinary microalbuminuria, to detect very early leakage of protein so that we can control it. To prevent such microalbuminuria, we generally have to have a good glycemic control. Blood glucose should be good, as well as your blood pressure also should be good. And if protein leakage is there, your physician or your nephrologist will advise you appropriate medications. The most important thing again is your good lifestyle and nutrition. You need to have a healthy lifestyle, avoid smoking, alcohol, tobacco consumption, have regular exercise, aerobic, at least 45 minutes per day, 5 to 6 times a week, and then you also need to make sure that your diet is good. A balanced diabetic diet is very important. The principles being small, frequent meals, avoid refined carbohydrates, avoid trans fats, ready-made foods, bakery items to the extent possible, reduce your oil intake, and then increase your intake of green leafy vegetables, salads, and fruits. Avoid juices. Anything refined causes the blood glucose to rise very rapidly, so it is always good to have a more complex carbohydrate so that it can be broken down slowly and the blood glucose rise over a period of time is very less. There are something called as continuous glucose monitors which are available, wherein you can put a small patch here over your elbow, and then in your phone you can get the blood glucose reading for about 14 days. So you do not get yourself pricked every time to check blood glucose level. Overall, with a good diet, good lifestyle, and then regular monitoring, both the blood glucose and other complications of diabetes which I have enumerated, you can lead a healthy life. And finally, before we end, take care of your bad cholesterol level also, which is called as LDL, preferable to keep it below 100 so that the complications of heart attack, paralytic stroke actually come down, and then you can lead a normal life. Thank you.